Let's talk about social determinants of health. That's a term you may have heard recently. And what does it mean? It may surprise you to know that there are non medical issues that affect our health. Things such as lack of access to healthy foods, lack of access to healthy housing, transportation, and interpersonal violence can lead to or worsen chronic conditions. One of those things alone can take a terrible toll on someone's health. In communities of color, often all of those are present. And why is that? Policies in our country historically have purposely excluded people of color in many areas. We were not, and still are not, considered human by some. While there have been attempts to correct some of these policies, the damage was already done. When I first moved to North Carolina in 2005, I was surprised at the lack of healthy food in my community. I was aware that that was a problem in inner cities, but then I came to understand that stores like Whole Foods just don't appear anywhere that has a large population of African Americans or Hispanics or indigenous people. The well documented process of redlining has caused many of us to be forced to live on the other side of the tracks, where housing is often substandard and landlords do not keep up with repairs. Lead paint can still be found in many of the older homes, and mold removal is often not addressed. Sick housing leads to sick people. Many of our communities lack transportation options, and people who are underemployed often cannot afford to purchase a vehicle, let alone pay for the registration fees, insurance, maintenance, or even gas. That affects the ability to go to the grocery store that has healthy food choices, or even to medical appointments. There was a study done on adverse childhood events, or ACEs, that revealed that trauma experienced by children has an overall effect on their health into adulthood. It was learned that unresolved stress over a long period of time affects children's still developing brains and lessens the body's ability to fight off disease. To address these social determinants of health, the federal government has provided a grant to the North Carolina Department of Health and Human Services to run a pilot program. The program is called Healthy Opportunities Pilot. If you or someone you know are members of a managed Medicaid plan, such as AmeriHealth Caritas, Healthy Blue, United Healthcare, or WellCare, you may be eligible. If you are eligible, your Medicaid plan can pay for assistance with food resources, housing supports, transportation, and assistance with issues related to interpersonal violence or toxic stress. Call the number on the back of your card and ask about healthy opportunities. This has been Dawn Daly-Mack RN reminding you that Black health matters.